My name is Claire. I'm an EMT. I've been an EMT for about 5 years. What Illinois Heart Rescue teaches is bystander CPR training, so unfortunately, just a disclaimer, nobody will get a certification. This is more a refresher of knowledge, what to do in this situation. Some good news with bystander CPR training, no mouth-to-mouth anymore. So that is good news, especially everyone's like, is that a COVID thing? But that's also just, if it's a quick class, the American Heart Association and Illinois Heart Rescue, we kind of just focus more on compressions, as that is the most important part of CPR. So for CPR, one thing that we want to think about is what we're doing it for. CPR is done when there's sudden cardiac arrest, and there's a difference between that and a heart attack. Heart attack is a blockage of the heart, so like a kind of a mechanical issue. Sudden cardiac arrest is an electrical issue. The heart stops beating. Heart attack, they're going to present more with the pain on the chest, pain on the arm, pain in the stomach. You know, they'll talk to you a little before they collapse. And sudden cardiac arrest, it's for more age groups. So if you hear sometimes of like a teenager at a high school basketball game collapsing, it's more likely that than a heart attack. And they'll just collapse suddenly with very little warning. So first thing we're going to do is check responsiveness. To check responsiveness, we want to check for painful stimuli and verbal stimuli. So we're going to go up, tap their chest, pinch their shoulder, see if they respond to that. You can call their name. If they don't respond to any of that, then we're going to count them as unresponsive. What we're going to check next is breathing. So always good to check hand on the chest, hand over the mouth, see if there's any air moving. And if those two things are not there, then we're going to move forward to the next step. The reason we don't check pulse is because even for trained medical professionals in an emergency situation, digging around in someone's neck, it's often you miss it, you find something that's not there. It's much easier to check responsiveness and breathing in this scenario. So if those two things aren't there, it's a little different of if you're alone versus if you're in a group. If you're at church and this happens, there's a whole bunch of people around you that can help. If you're alone, not as much. So you need to cut down the things that you're going to do. If you're in a group, you want to call 911 and you want to send someone for an AED. It's good to delegate when you're doing this, because often if you just yell into a crowd, call 911, get an AED, people are going to kind of stand around, assume 911's been called. So you need to point and say, purple shirt, call 911, blue shirt, get an AED, and then I'm going to start compressions. You help me with compressions. So make sure you delegate in that scenario. If you're alone and you see that someone needs CPR, what you're going to do, call 911, put them on speaker, and then you're going to get right into compressions on your own. The amount of time we can decrease that they're down without compressions, their chance of survival increases. We want to get oxygen moving back to the brain, keep it beating until their heart can be restarted. So after we've done that, then it's just pretty simple. We're just going to do compressions. And we'll do compressions until the ambulance comes or until an AED comes. So to do compressions, one hand out, the other hand right on top. We want to lock our elbows straight out, because compressions with bendy arms, it's going to be much harder. So we're going to lock these out. What you're going to do is stick your knees in the patient's side. You want them on a hard, flat surface, because what you're doing is their chest is hard, the floor is hard, heart is squishy, and you're going to make a heart sandwich so that you can be their heart for them. You're going to put your hands in the center of their chest, right on the sternum, right on the hard bone in the center there. For women, it's much less likely that people will do CPR on women because of fears of whatever. Make it work. We want to make sure it's equal between women and men. So we're going to put our hands right here, and then we want to lean over with our shoulders above our hands. Because if we're back here, this is going to be a lot more arm strength, and if we're up here, this is going to be a lot more body weight. It's going to be a lot easier to do compressions. From there, we want to compress, for any age group, we want to compress half the depth of the chest. And what that means is, in this mannequin, we want to try to push down so that it's this deep. And I know you're like, you're going to hurt this person. They're already dead. So would you rather have a broken rib or would you rather be dead? You can't make that worse. So, and you're protected by law. And then for children and infants, same depth, half the depth of the chest. So, you know, kids, you're not maybe going to press with your full force depending on how big they are. Infants, you're going to put fingers like this, center of the chest. And then children, if they're small enough, you can do one hand, center of the chest. It kind of depends what works for you. You know, if you're tired, you might move to 2. We just want to get that compression. So we're like this. We want to compress about as fast as staying alive. I'm sure you guys have heard. And so it'll look about this fast. So it looks easy at the start, and then 2 minutes in, it's not so easy anymore. If you're in a group, it's really good. If they're not trained, be like, watch me for 2 minutes, because in 2 minutes, I need you to do this too, and kind of talk them through it. Another important thing to note is when you're pushing down, you're pushing blood out to the body. When you come back up, it comes back into the heart. So when we push up, we don't want to lean on the chest too much, like that, because then that won't allow refill in the heart. So we want to make sure, I'm not saying like bounce off, but let it fully recoil like that, and then go back down. You're going to do that until an ambulance comes or until an AED comes. So let me show you the AED. This is my training one. They all come with pretty similar features. Big, obvious buttons. And then sticky pads. These have a little diagram on them of where you're going to want to put them. For adults, it's going to be up here, down here. And then for children small enough, one on the front, one on the back. So when you press a button, it's going to yell instructions at you. For some AEDs, just a note, you have to plug the pads in. Your guys, as I checked, it's already plugged in. But if you're in a workplace or whatever, it might be different. So I'll show you how to put it on here. In theory, someone would be doing compressions and you'd be putting the AED on around their hands to limit time that compressions are not done. So.
Adult patient. If the patient is a child, press the child button. Remove clothing from the patient's chest. Remove packet and apply pads onto patient's bare skin.
Someone put these on terribly.
Apply pads as shown in the pictures. Press pads firmly on skin.
So you just lift up their shirt to put these on their bare skin.
Pictures. Press pads firmly on skin.
We'll see if it picks it up here.
Do not touch the patient.
So,
analyzing heart rhythm.
So that's one time we would stop.
Do not touch the patient. Analyzing heart rhythm. Shock advised. Do not touch the patient. Everyone clear. Press the flashing shock button.
And then this button flashes.
Press.
You'd press it.
Shock delivered. Begin CPR.
So it's going to tell you to stop to analyze the heart rhythm, and you don't want to be touching because you don't want it to pick up your heart. Oops, sorry. And then it would also say stop if it's going to shock the person, and you don't want to be touching because it'll pick up your heart rhythm as well. It might advise that a shock is not needed, and then you'd go back to CPR, and even if it delivers a shock, you'd also go back to CPR. Because there's the mechanical and the electrical part. Even if it kind of jump-started the electrical again, the mechanical's still a little behind, so you're just going to do compressions right after, either way. This reanalyzes every 2 minutes usually. So after 2 minutes, if it says stop CPR, great. If it says keep going, you're just going to keep going till an ambulance comes. Any questions on the AED?
But it will tell you no more CPR?
Yep. If it tells you that, yep. You know, sometimes if they show signs of life, you can stop. I mean, be sure, but yeah, it'll tell you and it reanalyzes every 2.
Are those pads just a one-time use?
Yeah, good question. So an important thing, leave the pads on. An ambulance is like, great, AED pads are on, they can use them. And then they are usually one-time use. And in fact, usually the AED machines are one-time use. So after an event, a center will have to get a new one. Any other questions? Yeah?
Yeah, you put the upper pad, is it specific to left or right?
Right side. So yeah, and so when you're putting one on, it's a little nerve-wracking for the first time. Take a deep breath, work around their hands. That buys you time when they're still doing compressions. It's on the right side and the left, and then the heart is kind of a diagonal in the middle.
So looking at the person, it would be on the left side.
Now you're making me think. Yeah. It's their right, your left.
Does the pad tell you which one goes to the right versus outside?
Yep, this one shows like upper right, and this one shows left lower.
So our
Oh, yeah.
AED is located right in the hallway here. So like if you're at Mass and somebody tells you to look at the AED, it's right here in the foyer. And there's a big sign that says AED, so it's easy to find. And it's really easy to use too. And we have, it's all set up and it'll walk you through.
Yeah, so your guys' is actually, I looked at it, it's pretty cool. So the pads come attached with yours, and then there's literally 2 buttons. On, which it'll then start talking at you. Shock, which if it needs a shock, this will flash, and you'll press that to shock the person. But yeah, these are the pads. You'd just unclip this and put it on. Yep.
Is there ever an instance where you shock more than once?
So sometimes it'll be shock, 2 more minutes, shock again.
Okay.
It's not usually shock, shock, back to back. You would do compressions in between. Did someone else? Yeah.
You just need bare skin. You don't have to take off. I mean, if she's wearing a bra or something, you just have to get it.
Yeah, just on bare skin. Yeah, just work around the bra. And don't worry about underwire or anything like that. Yeah.
How many compressions do you give in a minute?
100 beats per minute. Yep.
If a child, how would that work for a child?
Yeah, so I think yours has.
It's a separate one for the children.
Card that you put in here, right here. This is the child.
Okay.
So then you put that in the machine, and then that calibrates differently. So this goes right, you just put it right in there.
But you use the same pads?
Yep, we use the same pads.
Yep, if they're small enough, you can put one on the front, one on the back.
So regardless, this is a question, I get so confused with this. Regardless whether they're having a heart attack or an electric issue,
Uh-huh.
you're not going to really determine that. You're just determining if they're responding to.
Yeah, so if it's a heart attack and it's gone far enough, they're going to collapse and they're not going to be breathing or responsive. So basically, if they're not breathing, not responsive, either if it's from a heart attack or a cardiac arrest, you're going to be doing compressions. And that's just a reaction to the not breathing, not responsive. Don't worry about what it is. They'll find out later.
So if they're responding, they're talking, you don't need to do.
Yep, and so yeah, that brings up a good point. You know, maybe they, no, it brings up a good point. So maybe they collapsed and it's like a heat issue or a seizure. That's not going to present as not responsive, not breathing. That'll be like not responsive, breathing weird, or breathing, or heat issue. They'll just be unconscious. So yeah, those are the 2 big things to check. Yep.
And you said put the pads on the back of the child. Where does the pad go?
So yeah, center right between the shoulder blades and right in the center of the chest. Yep, right here. Yep, right in the middle.
What do you consider a child to be? I mean, you can't ask the age, but...
Yeah, so it's more of a weight thing if they're like, and what my supervisor always says is if they've hit puberty, they're going to be treated as an adult. If they haven't, going to be younger. So, and we're going to guesstimate on puberty. Yep.
So you're taking a person and you're pushing in half of their rib cage.
For choking?
The depth.
Mm-hmm. Yeah, and that's pretty hard when you think about it. These mannequins are good because it shows how hard it is to do. And we just say push hard, push fast, try to push them in half. Adults, you really should not worry about pushing too hard. It's much more often that people don't push hard enough in CPR.